So we're only going to need one needle poke on each side, just to kind of get where we want it. So the hardest part with these cannulas is they're blunt, so actually getting them into the hole that you just made is kind of the hardest part sometimes. And this filler is very long-lasting, attracts a lot of water, so you don't want to put it near the eyelids, which are very thin and bruise quite easily. It's a little bit trickier in the lips. I still have to find myself using small needles in the lips. Maybe just a little bit more right there. The other thing that's nice about these fillers, they're pretty malleable. They're easily maneuverable. Some areas you can inject some lidocaine into a block, and that works fine, but I think with the Pronox we probably don't even need that anymore.
Cleaning, so like the...
So we've just did some Voluma in the cheeks, about 0.6 cc's on the left side, about 0.4 cc's on the right side. Lasts about 24 months. And we've got some Volbella here for the lips to give her a little bit of a subtle augmentation. Right now she's inhaling nitrous oxide, known as Pronox. It's 50%, and obviously very comfortable. Just stab in the corner of the lip, in the commissure as it's called. And we're going to use a cannula on the edges, and we'll use some needles for a little bit more fine-tuning. It's a 30 gauge needle, it's very fine. So the challenge with these cannulas is actually finding the initial hole. Just had some topical analgesia, so this poke hole is along the central part where I couldn't quite reach with my cannula. Much less bruising with the cannula.
Oh, looks good.